Hi guys, Gabby Gallaga here. Welcome back to my YouTube channel. If you're new here, please feel free to click the subscribe button. Also click the like button if you enjoy this video. Don't forget to also click the notification button, that little bell that you see in the corner, so that way you can be notified when my next videos come out. For the rest of you, welcome back. Today we are going to talk about a potential career option for some of you. I know that once you graduate from high school, you want to start thinking about what type of career you want to pursue. And some of you might want to start thinking which career pays more, which career will I enjoy the most, which career is beneficial, and just as we learned from COVID, would be essential. Something that would be guaranteed to have whenever is needed. I will discuss some options as we go, but today I'm going to talk about a career in the medical field. Maybe something that some of you might want to start considering if you're either graduating from high school or you're in college and you're still taking your general classes and don't know which option to take. Maybe this video might help you either understand what this field is more about, or it might also help you decide if this is a career path you would like to pursue either in the meantime, permanently, or just to try things out. I'm going to talk about medical assisting. Medical assisting is a very common career. It is practiced throughout the entire United States, but it is something that if you either plan to stay in the US or are planning to come to the US for, maybe this is a career that you guys might enjoy. In the medical assisting field, there are many different ways you can go, many different specialties you can enter, but let me go ahead and talk about how to become a medical assistant. There are 3 types of medical assisting levels that you can start off with. One of them is known as CMA, a Certified Medical Assistant. Now, to become a CMA, you can go to any trade school that offers medical assisting courses. You can also go to a community college that offers medical assisting courses. Usually it's about 6 months long. Once you graduate from the program, you would just have to take the state test that makes you a certified medical assistant. I have looked into it in the past. A reason to why CMAs have to go a different route is because you have to not just take the state test, but CMAs are usually well needed within like dermatology departments, such as like cosmetic, like plastic surgery settings. They usually prefer certified medical assistants. Now, CMAs do tend to take more because you can also take on county jobs and, like I mentioned, plastic surgery departments. When I looked into becoming a CMA and I looked at sample questions of the exam, it is a very general exam. There is a manual that you can study. There is, I believe, an online course that kind of walks you through, teaches you, and prepares you for the exam. You obviously do have to pay for the course, and you obviously do have to pay for the exam. The last time I looked into taking the exam was about a year ago, and it costs roughly about $200 to take the exam, whether I pass or fail. If you pass, obviously you receive a certificate. If you fail, well, then you have to study for it again and retake the test. If it is something you want to pursue, go for it. I would highly recommend it because the pay is a lot higher than average medical assisting positions. If you do wish to work in plastic surgery or even with county jobs, this is definitely one step you would have to take. The second option is becoming medical assistant with your AA certification, meaning your associate's degree. You can also go many different routes. In trade school, you would have to take your basic courses, like prerequisites, such as English, math, anything that's required in a 2-year university or college. All those courses, and on top of that, you would have to take your medical assistant courses. So once you graduate, you've done your 2 years of schooling, you've completed all your medical assistant courses, you can now receive your certification as an associate's degree in medical assisting. Now again, because it is actually a degree, that gives you a little bit of leverage from just a regular medical assistant, because you actually have a degree. You're not just certified. You can definitely further your school. You can bring it up to your bachelor's, to your master's, to the point where you can start teaching medical assisting in classes. There's many different routes you can go if you want to further your education medical assisting that route. And lastly, the third type of medical assisting is obviously just a medical assistant. Now with medical assistant title, you would either go to a trade school that offers medical assistant courses, or you can go to a college or university and take, which is roughly about 6 to 8 months of medical assisting courses, depending on the semesters, depending on how long it is, etc. There's many different ways you can pursue your courses in medical assisting. Once you graduate from the program, you just receive a certification of completion in medical assisting, and once you are searching for a job, you just provide that certification. Along with that certification, you also take mini certifications for like phlebotomy, medicine administration, venipuncture, EKG. You would just provide it to your employer, and that's proof that you took all the medical assisting courses and you are prepared. Now, getting a job in medical assisting, it can be a little challenging if you're freshly out of school, because sometimes some employers require experience, but how are you supposed to get started if you do not have experience, right? I would suggest look everywhere. Apply everywhere you possibly can. Some places are in desperate need, high demand. Okay, they will train you on the spot, but they just need staff. Others, you can start looking for free clinics. Some free clinics take volunteers. I know that I had to do my internship in a free clinic, and that kind of helped me a lot, because since it was a free clinic, I got to see every aspect of every specialty, and it helped me decide which route I wanted to go to, which specialty I felt like I would enjoy the most. So that is definitely one thing. Plus, you get to help people in need, right? So you help your community, you gain some experience, you are also networking. So you get to meet people, and if they get a job somewhere, they can recommend you, and so on and so forth. So free clinics are always a really good option. But if you want to start searching for a job immediately, then just apply anywhere. You can go to monster.com, careers.com, jobs.com, wherever you feel that you need to apply everywhere and anywhere, and eventually you will land a job. Now, pay rate really depends on where you're working. It depends on the area, the county, the specialty, etc. When I started working as a medical assistant, I believe the starting pay rate was anywhere between $13 to $14 an hour. Now it's a little bit more because of the increase. So it's really difficult trying to find a job that pays you where you want to make. I would suggest don't ask the employer how much they're offering. Check it on Glassdoor.com. A lot of people that work with certain companies will post how much they're making, their experience working for the company. So it's a really good and safe insight as to learning more about the company versus asking the employer and coming off as money hungry. I've never liked doing that myself, and I put myself in the management's position, and I would think that the applicant is applying for the job just because of the money and not because they want to seek a career or an opportunity. So go the Glassdoor.com route, or maybe talk to someone who works within the company and maybe they can be honest about it. So finding a job within medical assistant field can be a little competitive depending where you apply. So if you find a company that pays really well, I know that Kaiser is extremely difficult to get into, just because they're one of the highest paying employers out there, and everyone obviously wants to start making the most money within that career. If you do want to go the Kaiser route, I know that Kaiser has alerts, so you can go to their career page and you can leave your email with them, and they will send you emails whenever openings occur. Now, they won't just send you emails with openings in the area that you are looking for. They will send you openings nationwide. I know I received some alerts saying that they're seeking medical assistance in Hawaii. I'm not looking to relocate to Hawaii, but it's good to know that those options are available. So that is definitely one route you can go. Now, in medical assisting, just like any other medical field, there are specialties. There could be like pediatrics, dermatology, OB GYN, family practice. So there are many, like podiatry, cardiology. There are many different departments that you can go into. I personally work for OB GYN, and I will be making a separate video just on OB GYN, telling you my experience, telling you what it's like working for that department, and see if maybe that's a career you guys would be interested. I will definitely leave the link on the description to kind of give you guys more insight in that specialty. Now, thank goodness, as of now, we don't need to go through any additional training when we want to decide on specialties. It's solely training on site. So when you're done with medical assisting school, you just start applying for jobs, and you can apply for any position that if you just want to get a job, just start anywhere. But if you're looking for a specific specialty, then make sure that you do search for that specific specialty. Some jobs will post what specialty that medical assistant is needed for. Others won't. Others will have codes. So I believe in that case, just take it as far as you can go. Once you get reached or you are offered an interview, you feel free to ask, which department is this with? What specialty is this? And then you can decide if you want to continue with the process or not. So for some of you, you may not want to pursue medical assisting as a permanent career, which is fine. Some of you just need medical assisting, or you need some other career within the medical field as a stepping stone to advance your medical career, such as nursing, physician assistant, even medical school. So I know that it's a sort of a prerequisite, and it's just, I believe that the schools and the programs do this with the intention of making sure this is the route you want to go, because school, especially medical school and nursing, it requires dedication, hard work, and it's a lot of investment, money, time, effort, etc. So they want to make sure that they recruit the right candidates, because you also have to have people skills. So if you're going to enter a career where you will be working with people, they want to make sure that you're comfortable with that and you have really great people skills, right? They don't want someone who's just walking into because of the money, and once they're in it, they don't know what they're doing, they're being very careless, etc. So medical assisting is definitely a good way to start, because it gives you the other side of the story, right? You get to see the efforts of the people that assist you if you become a doctor, or even as a nurse, because nurses do work in medical office and medical assistants do assist nurses in certain tasks. And PAs as well. If you become a PA and you work in a doctor's office, you will have a medical assistant working with you. So you get to understand what their job title consists of, what's within their scope of practice, what it is that they are allowed to do within their title, and so on and so forth. My recommendation when you pursue a career in medical assisting is there's a few things that you do need to know, that you need to master, you need to be really good at, because if you graduate from medical assisting school and you want to start getting a job within the field and you're not really good at these, you're not going to succeed and you're not going to do very well. You will be struggling, and it's not going to look good on your behalf, especially if you're looking to advance or receive recommendations. One of my suggestions is knowing your vitals manually. Some employers have electronic machines that take your temperature electronically, blood pressure electronically. You just wrap the cuff around their arm and press the start button, and it starts taking their blood pressure. It's a digital scale where the person just stands on the scale and the scale just gives you a number. And then there's some clinics, some locations that don't, where everything is manual. You would have to bring your own stethoscope, and you would have to take their weight using those old school scales. You have to do everything manually. So if you do start a job and you don't know how to do any of that manually, it's not going to look good for you. Here's a little tip for you. When you're doing the blood pressure on a patient and you're using the cuff manually, the first thump is the systolic, which is the top number when you're taking the vital, and as you're releasing, the last thump you hear is the bottom number, which is the diastolic. Those numbers are very important because if the patient has a high blood pressure, you need to notify the doctor, especially if the patient is pregnant. If the blood pressure is extremely low and the patient's not feeling well, chances are that patient might be ready to pass out. So it's very important to know the vitals, and especially in the setting that you are working in. So that's just one little tip I can give you. Another tip, you would have to be flexible working both front office and back office. Now, some locations have you rotate both departments. Some days you're at the front, some days you're in the back. If someone calls out, they want to pull you and put you in certain departments. Others, you're strictly back office, but they would like you to have some front office knowledge, and it just goes on back and forth as it is needed. When you go to medical assisting school, they will try to train you to think that way because many locations do require both. But some locations that don't, it's just good to know, just good to have, because it gives you advantage versus other candidates that don't have experience in front office. It will make you stand out more if you do have experience with scheduling, taking phone calls, taking messages, sending messages, etc. Another tip I like to offer is you have to be computer savvy. If you're not, it's going to be very difficult because now we don't do paper charts anymore. Everything is electronical. Every chart is electronical. Everything you do will be in a computer. You will communicate with doctors. Doctors will fill prescriptions through the computer. You will send messages through the computer. You will enter vitals through the computer. You will document through the computer. So every job, every organization will have a different system. So don't worry so much about learning all the systems, because once you start the job, they will teach you the system. So don't stress over that. But you do want to be paying attention. You want to take notes as you're training, because it is very important to catch on quick and try to minimize errors, especially when you're administering medication, when you're drawing blood, stuff like that. You need to know how to read the documentation so you don't administer the wrong medication to the wrong patient, etc. You have to know your 6 rights of medications, and you have to make sure you practice it within the computer system. CPR, you also have to be CPR certified. When you apply for a job, most employers will ask if you are CPR certified, and they will also ask for proof. You can go, depending on which organization you work for, you can obtain your CPR card through the American Red Heart Association or through the Red Cross. I know that right now most employers are requesting or prefer CPR certification through the American Heart Association. There's a lot of people, a lot of companies out there that do training from home. They do training online, where you do one portion online and the other portion you go on site. You do have to work with dummies, so you have to demonstrate that you understand the concept of the CPR. You have to purchase a booklet or you keep with you. They're constantly updating. If your CPR certification expires while you are employed, your employer has the right to suspend you for not having your CPR card renewed while you are on site. So you cannot return to work until you are renewed. So I know some employers do offer CPR certification on site. You just have to schedule it and plan it ahead of time before yours expires, or you just have to make sure you become certified elsewhere as long as before your current CPR expires. And you do have to show proof. You have to provide it to your manager, and you have to provide it to human resources so they can have it on file, because it is a liability. When you are a medical assistant, you have to be comfortable being on your feet because you're constantly walking around. You are always jumping from one place to another. You're going into the exam room, you're going back to your desk, you're documenting, you're walking over to the refrigerator to obtain medication, you're going to the supply room to obtain supplies, or anything that you need for blood draws, or whatever it is that is needed during your shift. You also have to be comfortable with body fluids. Now, what I mean by being comfortable with body fluids is because you work with a lot of body fluids. So whether you work with a lot of urine, you work with a lot of blood, or you work with other stuff, samples that get collected, and you have to be comfortable touching it to either break off a swab or create a slide for the doctor to put under the microscope, etc. So if you're not comfortable working with that, chances are this is probably not a career for you, because you do a lot of that on a daily basis, especially depending on the department you work for. So if you work in pediatrics, if you work in OB GYN, if you work with urology, you are definitely going to be working with a lot of blood, you will be poking people, and you will be working with urine. Another skill that is highly needed in medical assisting is you have to be friendly. You have to have great customer service skills. I cannot emphasize how many times I have personally worked with people who have been rude, have lacked a lot of customer service skills, have tried to avoid helping people, have not tried to go the extra mile to help someone, or I have even been to clinics myself as a patient, and I have received that kind of treatment. Let me tell you that you are entering this career to service people. You are entering this career to help people. So why are you going to work in a field that you do not want to be friendly or have the goal to help someone? So it doesn't feel good as a patient to receive rudeness from either the front desk representative who's checking you in, the medical assistant who's vitaling you, etc. So you want to, not just for your company, not just as a job, but as a person, you want to be a really great person to someone else. Think of karma. What goes around comes around. You would like for someone to be kind to you. You would like for someone to treat your family member with respect. So why wouldn't you do the same for someone else? So very important, if you're going to enter a career where you will be working with people, make sure you enjoy working with people. Now, I'm not going to say that everyone out there is going to be nice to you and polite to you, because believe me, as a medical assistant, I have been working in this field close to 8 years now, and I have had my handful of patients that have been rude to me. But in the end of the day, I think to myself, hey, they must be going through something. They must be having a hard time. They're having a bad day. Don't take it personal. Do not let that one patient who is rude to you ruin your day. You have to just brush it off, because the next patient might not be like that at all. And if you let that get to you, you are going to project that onto the next patient, and it's just going to become a chain reaction. You don't want that. No, just let it go, brush it off, ignore it. I worked for an OBGYN where we had a gynecologist oncologist who saw a lot of cancer patients, and I think those patients were probably the most difficult because they were cranky all the time, they were rude all the time, they were very difficult. You would tell them to do something like undress or leave a sample, they would either give you an attitude or wouldn't do it, and believe me, they test you. But that's not the point. I tried to see it from the other side of things, and I understood. These patients have cancer. They are stressed out. They've taken so much medication. Some of them have lost hope. There are so many overwhelming emotions that are going through the patient that we can't be rude back to them. What would we achieve in that? Nothing. It just creates more tension. We just have to be more understanding. You know, just be forgiving, let it go, understand they're having a bad day. You would probably feel the same if you went through the same thing. So just spread kindness. Medical terminology. I would highly suggest that you also become knowledgeable with some medical terms, because you are working in the medical field. You will be talking to doctors, you will be talking to nurses, and you do have to document on the patient's chart. So depending on which specialty you go into, you may have to know basic terms of whatever field it is that you're in. So I know that is certain positions, some doctors will say, please have patient lying in the supine position. So you want to make sure that you understand the office you're working in and what it is that the doctor is asking of. And especially when you're documenting certain issues with the patient, like past surgeries, you need to understand what type of surgery that was. Instruments. Instruments is another thing that you also need to understand. And when I was going through medical assisting school, for me, I hated instruments because I only learned instruments in a book. I never actually got to hold an instrument in my hand. So it was difficult for me to remember the names of all the instruments. So depending on which specialty you will be going in, you may not work with any instruments at all. You may work with all the instruments, or you may only work with just a few. But it's always good to know which instrument you're working with, so when the doctor's doing a procedure, you are very well aware of what instruments are required for that procedure. Another requirement for medical assisting, and I believe this applies to every medical staff, whether it's doctor, nurses, etc., no matter if you work in a clinical setting, hospital setting, they will always require that you obtain the flu vaccine on a yearly basis. So once flu vaccine hits, you need to obtain the flu vaccine. Most employers will provide either a sticker on your badge, or will need some sort of documentation stating that you did receive the flu vaccine. You do have the right to refuse the flu vaccine if for some reason you just don't want to have it, whether you don't believe in vaccines, you don't feel it's safe, whatever your reasons may be. But know that you do have to wear a mask throughout the entire flu season as a prevention. You can either use it, you would have to have, just like we're using it during COVID, some of us that work in the medical field do have to wear a mask during our entire shift. So you have to make sure that the mask is fully covering your face, so from your nose to your mouth, and you cannot just have it like down here where you have your nose sticking out, or your whatever. I've seen some crazy stuff. I'm like, no, you have the option, either take the flu vaccine or wear a mask. But it's for your safety, it's for patient safety, and it's just during the flu season once COVID is over, right? So hopefully things get better there. For those of you who are allergic to egg and egg contents, they do offer egg-free flu vaccines. So I would check with your human resources department. They should have those available. I know that most locations do offer preservative-free for employees as well. So that is also something to kind of help for those of you who are hesitant in receiving the vaccine. Another quality that is very, very much needed and very much appreciated in the medical field is being a team player. So if you enjoy being in your own space, working on your own, this is not the career for you, because you are working with everyone. You're working with other medical assistants, you're working with nurses, you're working with doctors, you're working with patients. There is a lot of teamwork involved. Now, let's say you have some free time, right? You're not working with a doctor, you're just catching up on paperwork, or you're doing some stuff to help around the office. If you see that a staff member is drowning in their work, jump in. You have to be ready to jump in and help. Same thing if you hear a doctor ringing for help and no one's available to go in, get ready to jump in that room and help out with the doctor. Or if you see that front desk is super swamped with checking in patients and doing front desk duties, and there's very low copies of certain documents that we need to either pass out or have patients sign. Be a team player. If you have extra time, you know, maybe 2-3 minutes of your time just making 20-50 copies so that way everyone has enough, that doesn't hurt. So those are just small examples of being a team player within the medical office. For uniforms, you will be wearing scrubs, tennis shoes, be comfortable wearing gloves. If you, again, depending on the department you work for, if you have to wash instruments, you have to wear a certain coat to help with the splashing, a face shield, a mask, or gloves as you're washing your instruments, sterilizing, and all that good stuff. Be comfortable with stuff like that, like an autoclave and certain chemicals that require sanitation of instruments, certain wipes that are meant for the medical field, where you have to wipe down exam tables and desks and stuff like that. Last but not least, I would highly recommend that you are comfortable poking people, because you will be doing a lot of poking. So if you work with pediatrics, family practice, OB GYN, just to name a few, you will have to administer medications. You will also have to draw blood. Some locations don't require that you draw so much blood. Others require that you draw blood all the time and administer all the time. For example, pediatrics, they're constantly administering vaccines. And with pediatrics, you have to be very careful because A, there are a lot of medications, there are a lot of vaccines that sound alike. They have they sound very similar, and obviously in children you're only allowed to vaccinate a certain amount of medications, and you have to administer the appropriate medications at a certain milestone in their life. So you cannot administer a 2-month-old something you would administer to a 2-year-old, etc. So you have to be very careful with that. In OBGYN, we draw blood for genetic testing. We also draw blood for prenatal care. We administer vaccines such as the Tdap, flu vaccine for our pregnant patients, RoGAM. So there are many things that we administer. We have to make sure that we document appropriately. We exercise our 6 rights for medication administration. It takes practice. Don't feel bad. If you're new to this, don't feel bad. I know you think, oh my gosh, how am I going to poke someone? But it's okay, because when you go through medical assistant training, you will either train on each other or you will train on fake arms, and you have to learn to find the vein, you have to learn to apply the tourniquet and insert the needle and withdraw the blood, or you have to find, know which medications you have to inject intramuscular, etc. So these are all things that you will learn in medical assisting school. So don't feel pressured, don't feel stressed out, and don't feel intimidated. It's a very fun career. I have enjoyed it. Maybe for some people, but it's not for everyone, but you won't know until you try it. So my suggestion is go ahead, just have fun with it. Learn as much as you can, try out different specialties, see which one fits best for you and which one you enjoy the most. And practice makes perfection. So don't feel bad if you don't get it the first try. The more you do it, the more you will find tricks here and there, and you will be a pro. Soon, before you know it, patients will be complimenting you, telling you that they didn't feel a thing, that you're the best, and believe me, that goes a long way. Having that said, thank you guys so much for joining me on this video today. If you haven't already, click the subscribe button, click the bell, the little bell you see in the corner, so you can be notified of when my next videos come out. If you enjoyed this video, give it a thumbs up. Please share with anyone whom you think would appreciate this content, someone who's looking into pursuing a career in medical assisting, or maybe just some idea of what is available out there, or anyone who would just in general enjoy this video. Thank you so much for joining me again, and I will see you guys at my next video. Bye.